My name is Liz. I'm from Massachusetts, and I began searching alternatives to knee replacement after a very poor experience at a facility in Massachusetts. I was given no options. I had a sore knee, and nobody asked about what was important to me. So I started searching, and I discovered Dr. Pearl, and I upon reviewing the website and looking at how this works, and it all made sense to me that I could use my body to heal my body. And so I decided that I was going to give it a shot. And on May 5th, I had the first part of the two-part. I had no swelling, no pain. The aspiration part of this, it's not pleasant, but it's tolerable. So whatever they do, whatever Dr. Pearl and her team does to spin them down, they pull them out, they spin them down, and then they put them into the affected area, the area of treatment. In my case, it was my right knee. So I did that. I required no pain medication. I took the medication at Dr. Pearl's office the day of the procedure as they instructed me. But after that, I required no pain medicine. 1 month later, I came back and I had the platelet-rich plasma. That too was just unbelievable. I can't really explain, but I feel like not only my knee is better, but my whole body. I feel like I got WD-40 in my knee. And I went to physical therapy. Dr. Pearl recommended do the therapy. I went. I had 4 sessions, but the 2 weeks between the PRP and the last physical therapy visit, which was a week ago tomorrow, I noticed myself tremendous surge of strength. And I was tested for knee strength, and my knee went into way normal limits. And the PT guy said, there's nothing I can do for you. You don't need me anymore. Dr. Pearl said, let pain be your guide. So I'm happy to say I don't have any pain. I'm back to yoga. I just started back. I do work with a personal trainer. I do credit a lot of my recovery to the way I went into the procedure. So I believe that following the protocol that was provided by Dr. Pearl 2 weeks prior to the initial first treatment was extremely beneficial. And I continue that protocol today because I was told I need to continue it for 4 months. It's just taking, it's not a big deal. It's taking 2 pills. I would say that prior to the procedure, my level of discomfort was about a 5 or a 6. I was wearing a knee brace because it kept the pain at bay. I still had some pain, but interestingly enough, when I started the protocol, I found that the knee brace was actually more uncomfortable than having nothing on. So the supplements as prescribed, they're great. I also take the medical grade liquid collagen with the aminos. That's also part of it. And I'm going to continue to take that. I don't have any pain. I go up and down stairs. I go to the gym. I do yoga. I do the elliptical machine at the gym. I do stretch. Dr. Pearl recommended a book called Knee Ability Zero, written by this guy. And I got the book. And in that book are stretches because this author credits strength around the knee as part of, I will be a patient for as long as Dr. Pearl will have me. I believe that if I have any other issue, if I have an issue with my left knee, which I don't have one right now, but if should I have one, I'm the first place I'm going to call to see Dr. Pearl. I'm 65 years old and I will be turning 66 on August 4th. So activity is a big part of my life. And to have that all of a sudden taken away, I couldn't deal with that. I couldn't accept it because first of all, I thought if I can heal my body with my body, why wouldn't I do that? Because there's so many positives to doing that. There's no rejection because the cells are my cells. It was natural. And the way I figure it is, I got to this point at 65 years of age on my knees. So if I do this, I'm sure I'm going to get Not that I'll live that long, but another 65 years. She told me every step of the way, this is what I'm going to do. The first part of the procedure was the bone marrow aspirate. And I knew exactly when she was going to pull to get the fluid. And really, she's amazing. She's a gifted healer. And the world needs more people like Dr. Pearl. And my only hope is that this particular clinic and provider and other clinicians that may be like her can be brought more into the spotlight. So my only message is, even if you think there's no other alternative, explore it anyway. It's a visit, it's information. I just don't know how to get this out to the masses because it's really important.